Welcome to my session on online surgery class. Today the topic will be examination of the neck and thyroid. Okay, this is a simple guide to how you go about examining a patient with a thyroid problem or some swelling in the neck. Okay, the examination of the neck is a very important subject for clinical exams in the final MBBS exam. So you must be well prepared and must clearly understand the various steps that are involved in the examination of the neck and the thyroid. So I hope the most important thing is to get experience in examining is to see a patient and examine as many patients as possible. Okay, and that will make you more stable and more steady in presenting a case of neck examination.
First, before you proceed with the examination, it's very important to take a good history. And this involves the swelling, history of the swelling, and whether it's localized or diffuse, the onset, acute or chronic, whether it is associated in pain, then progression, whether it is progresses fast or is progressive in size and symptoms. Then the other important one is pressure symptoms due to the size of the lump in the neck, and this includes hoarseness of voice due to recurrent laryngeal nerve involvement, dysphagia due to pressure on the esophagus, stridor or breathless, which is due to pressure on the trachea. The next to look for is altered function of the thyroid, whether it is hyper or hypofunction. Okay, we have the good careful history to assess the hyper or hyperthyroid functions are encountered in that patient. Then looking for metastasis in the cervical lymph nodes is the most important. The 6 or 7 groups of lymph nodes in the neck must be carefully examined and look for evidence of metastasis. And lastly is the constitutional symptoms associated with this: malaise, fever, loss of weight, and generalized feeling of unwellness. Having taken a good history from the patient, next we proceed on with examination, which consists of a number of steps. First is your introduction and greeting of the patient and proper positioning of the patient. The best position to examine is the patient sitting on a chair. So the thyroid or neck is examined from the front, inspection and palpation, and watching the movements of the mass on swallowing and protrusion of the tongue. After that, you inspect the neck from the side, and finally the palpation is done from the back with the patient sitting on a chair. The lump is palpated clearly, carefully to determine the shape, size, tenderness, movement, and whether it is mobile or otherwise. The next thing to examine from the back is the thorough examination of the lymph nodes of the neck. The 7 groups of lymph nodes from the neck, which I shall highlight in a short while. Then very important is, if it is a large goiter, it is very important to look for retrosternal extension by percussion below the clavicle on the affected side. Auscultation is very important to determine whether there is a bruit that is heard. The other one is hyper and hyperfunction. Signs of hyperthyroidism and hypothyroidism are very important. The right number of symptoms and signs which can be detected on these patients. And lastly will be your special test, which I shall mention in a short while. Then you look for the signs on examination, especially the most important sign is a lump in the neck, and the most common of this is from the thyroid, which moves on swallowing, and it is The lump must be carefully examined by palpation to see whether it's a solitary or multinodular goiter, whether it is a diffuse swelling or nodular swelling. The location, consistency, movement, whether it is solid or cystic, whether it's fluctuant, and also the actual size of the swelling. Tenderness is another important sign to look for. So are the special tests or examinations, checking for the position of the trachea to see whether there's any tracheal deviation, retrosternal extension, which I mentioned just now, and evidence of hyper or hypothyroidism, and the presence of cervical lymph nodes, if enlarged, to determine which group of lymph nodes are enlarged.
Okay, the examination of the neck is done with the various positions. First is the greetings of the patient, and ideally the patient is sitting on a chair, and then you continue the various parts of the examination. And the first one is from the front, where you inspect for lumps, sight, size, shape, movements on swallowing, and tongue protrusion. Then go ahead and do the Priscillo and Pemberton signs, looking for skin changes, and also continue with palpation for tenderness. The next part is the examination from the back. Okay, the patient is sitting on a chair. Here you palpate for the details of the lumps, retrosternal extension, and movements during swallowing and tongue protrusion. Palpate for cervical lymph nodes, especially the deep cervical lymph nodes. Describe and palpate them in detail. Look for the carotid pulse, the Berry sign, and tracheal compression with the Cocker sign. Also auscultate the lump for fluid thrill or bruit. After this, you come back to the front again, where you check for the position of the trachea, whether it is central, and percuss for retrosternal extension of the goiter. And then look for signs of hyper and hypothyroidism, and carry out the special tests in the patient for thyroid. After doing this, you come to the summary of the physical findings, okay, and then coming to the possible diagnosis, provisional and differential diagnosis, justifying you with the necessary signs that you detect in the patient.
Okay, here we have some pictures to show you the examination of the neck and the thyroid. Here, examination from the front. Again, from the front, another view to examine the various aspects of the neck. Okay, here the front, then this is basically looking for the cervical lymph nodes, the 7 groups of cervical lymph nodes. And this again, examination from the back. The palpating the thyroid on both sides and the cervical lymph nodes with the trachea. This is another picture showing you the examination of the trachea, location of the trachea, okay, determining the position of the trachea. The trachea should be in a straight line in the midline of the neck, okay, continuation from the thyroid cartilage here, okay. This is a central located trachea. Here there's a deviation of the trachea to the left, and here the trachea is deviated to the right. So there's a gap between on the affected side. Okay, this is another way to show you the demonstration of the tracheal deviation. Okay, this slide summarizes what I've been telling all this while. Inspection of the neck from the front, the various aspects of the examination. This one, examination from the back, and this is looking for the palpation for tracheal deviation, which is done from the back. Okay, here it shows the patient sitting on a chair with the examiner standing at the back. Okay, so when you examine, these are the structures you have to look for. Okay, you got your larynx here, thyroid, right lobe, left lobe. There's a nodule in the thyroid here, and this is the trachea. The various steps in the thyroid examination include: first, inspection of the neck from the front and the back. Next, testing the movement with swallowing. Ask the patient to swallow. Palpate the neck from the back, flexing the neck slightly to reveal the gland more prominently. Palpate both sides, both lobes of the thyroid and the rest of the neck for lymph nodes. Then the additional tests which I mentioned just now should be looked for. Then look for general and peripheral signs of hyper or hypofunction of the thyroid, and especially look for eye signs of thyrotoxicosis.
Next, we come to the special tests for thyroid lumps or goiter, which include the Pizzilo's method for short necks, Pemberton sign, where you raise up the arm and the face get congested. Berry sign is the involvement of the carotid pulse. Cocker sign, involvement or pressure on the trachea leading to stridor. Leahy's method is used to examine each individual lobe of the thyroid. The Kryle's method, where small lumps can be palpated using pressure on the thumb on the gland. And also look for Horner syndrome, which includes meiosis, ptosis, anhidrosis, and enophthalmos, retraction of the eyeballs.
Okay, these are some of the special tests which I mentioned. Pemberton sign, where the patient is asked to elevate both their hands above the head, and if there is a retrosternal goiter, it causes compression on the thoracic veins, great veins at the thoracic inlet, causing venous congestion and redness of the face and head. Here is a Pizzilo's method, where the patient uses his hands to extend the neck, and the hands used to rest the head as the neck is extended to make the gland more obvious. And this is very important for patients with very short neck. This is the Kryle's method, where pressure is applied onto the individual lobes to look for, to detect small nodules in the lobe. And here is the Cocker's test, where pressure on the nodule from the thyroid may result in stridor due to compression of the trachea. This slide shows you the functional disorders of the thyroid gland. It can be hypofunctional or hypothyroidism, or hyperthyroidism due to either this decrease or increase thyroid hormones. And here in hypothyroidism, all the body functions are decreased due to decreased thyroid hormones. Whereas in hyperthyroidism, all the body functions are increased due to increased levels of thyroid hormones. Okay, here I've listed the complete list of signs and symptoms of hypo and hyperthyroidism. And the 10 most signs and symptoms of hypothyroidism are here: goiter, bradycardia, cold intolerance, weight gain, dry skin, puffiness, constipation, irregular periods, especially decreased periods, sleep, patient like to sleep more often, and hypercholesterolemia. Whereas in hyperthyroidism, is the bulging of the eyes and other eye signs associated with hyperthyroidism, goiter, palpitations, tremors, heat intolerance, sleep problems. Patient usually unable to sleep, has got unable to sleep, diarrhea, menorrhagia or increased menses, excessive sweating, and patient is very anxious. For those who like to use mnemonics to remember the signs and symptoms, here are the mnemonics for the signs and symptoms of hypothyroidism. Okay, the mnemonics will be the thyroidism. T for tremor, H for heart rate, Y for yawning or fatigue, R for restlessness, O for oligomenorrhea, I for intolerance to heat, D for diarrhea, I for irritability, S for sweating, and M for muscle wasting. Okay, coming to examination of the lymph nodes, very important. I say 7 groups of lymph nodes. Here you see 1A and 1B, submental and submandibular. Then you got your 2A, 2B, then you 3, 4, 5, 5A and 5B, and 6. For the thyroid, the most important is your level 6 or anterior group of lymph nodes. Okay, and this can be shown again in this view here. You have got your posterior lymph nodes here, posterior triangle of the neck, parotid, submandibular, deep cervical lymph, superior deep cervical lymph nodes, inferior deep cervical lymph nodes, and deep to this stenomastoid will be the middle group deep cervical lymph nodes, which are very important. Okay, this is the anterior view of the deep cervical lymph nodes. Level 1, submental and submandibular. Level 2 is the upper jugular lymph nodes, or the upper level 2 will be the upper or superior deep cervical lymph nodes. Level 3 will be the middle deep cervical lymph nodes, and level 4 will be the lower, level 4 here, the lower deep cervical lymph nodes, superior, middle, and lower. And level 5 will be the posterior triangle lymph nodes. Level 6 is the visceral or the anterior group of lymph nodes here in the same compartment as the thyroid. And level 7 is the superior mediastinal lymph nodes, which is below the clavicle. Okay, what are the common causes of cervical lumps? Can be thyroid, 2 large groups, thyroid and non-thyroid. More common will be the thyroid lumps, which consist of adenoma, cysts, multinodular goiter, or diffuse goiter. Thyroiditis, various forms of thyroiditis, malignancy, papillary, follicular, medullary, and anaplastic, and lymphomas, either primary or secondary involvement of the lymph nodes. Non-thyroid origin will be cervical lymph nodes, which I told you, the 7 groups of lymph nodes, lipoma and sebaceous cysts, congenital conditions such as thyroglossal cysts, cystic hygroma and branchial cysts, and last but not least, metastatic deposits from elsewhere, especially from the abdomen, from the lung, and almost every other site may end up secondaries in the cervical region.
Okay, we have just seen the various aspects of examination of the neck and thyroid in patients. Next, I'll show you two short videos. The first one on the summarized clinical examination of the normal version, and the second one is the OSC examination technique for examination of the neck and thyroid.
Thyroid examination. Examination of the thyroid gland starts with inspection. In doing so, it's important to consider the gland's anatomy and its surrounding structures. The thyroid cartilage is a helpful landmark, since the thyroid can be palpated bilaterally below it. In healthy individuals, the thyroid only weighs around 18 to 25 grams and should not be visible. An enlarged thyroid, otherwise known as goiter, is considered class 2 if macroscopically visible. When the head is reclined, thyroid enlargement can be seen even earlier. Palpation is usually performed from behind, although anterior palpation is also feasible. The gland is often only detectable upon palpation if a pathology is present, such as nodules, enlargement, or an altered consistency. You should also note any tenderness to touch, as seen in inflammatory changes such as a viral infection. To assess the mobility of the thyroid gland, ask the patient to swallow and offer a glass of water if necessary. If thyroid perfusion is increased, like in Graves' disease, examination may reveal an auscultable bruit and a palpable thrill.
Okay, in this slide demonstrates the examination of the thyroid as required in the OSCE examination.
Hello there, my name's Andrew. I'm one of the final year medical students. Could I confirm your name and age, please?
Hi, I'm Simon and I'm 24 years old.
Nice to meet you, Simon. Today I've been asked to examine the thyroid gland in your neck. Would that be okay?
That's fine.
This will just involve me generally inspecting, then I'll move in closer to the neck to have a closer look, and then have a feel of the neck as well. Is that alright?
Sure.
That's great. Are you comfortable where you are?
Yeah.
Fantastic. We'll start. Simon, if you could just bring your arms out in front of you like this and splay your fingers. Fantastic. I'm just going to lay a piece of paper on the hands. If you could turn your hands over for me. Finally, I'm going to feel your pulse. Thank you. I'm now going to look more closely at your eyes. If you could just pick a point on the wall behind me. And now I'm just going to look from the side. And I'll now look from behind. If you could just look slightly up for me, Simon. We're just going to do some movements of your eye now, Simon. So if you could just follow my finger, do let me know if you have any pain or double vision. That's great. Again, if you could keep your head still and follow my finger for me. Thank you. I'm just going to more closely inspect your neck now. If you just stay as you are. And if you could just take a sip of this water and hold it in your mouth. And swallow. Fantastic, Simon. If you could just stick your tongue out now. And I'm just going to feel your neck as well. If you could just stick your tongue out for me, Simon. That's great. And if you could just take a sip of the water for me. And swallow. I'm just going to feel the glands in your neck. Fantastic, thank you. I'm now going to feel your windpipe. It might be a little bit uncomfortable. I'm now going to tap on your chest. And finally, I'm going to listen. If you could just take a deep breath and hold your breath there. And breathe normally. Simon, I'd just like to finish with some special tests. So we're going to start with the reflexes in your arms. If you could just relax your arms on your lap like this with your palms facing to the ceiling. Fantastic. I'd just like to look at your shins, if you wouldn't mind rolling your trousers up for me. Sure. Fantastic. And finally, if you could stand up, but first I'd like you to cross your arms for me. And relax. This completes the examination. Thank you very much. Today I examined Simon Sayers, who's 24 years old. On general inspection, he had a fine tremor of his outstretched hands, but there were no other peripheral stigmata of thyroid disease. There was no evidence of thyroid eye disease and no goiter. To complete my examination, I'd like to do some blood tests and look specifically at the T4 and TSH levels.
Thank you very much for joining me for this ultra short session on neck swellings, especially thyroid swellings.